Hi, everyone. Thanks for joining. I see we have participants coming in. We'll just give it a few minutes to let everybody join, and then we'll start. In the meantime, I've texted for everybody that's on now, and I'll repeat this again, of course, when we officially start, but I have texted on the group chat the link for the handouts. So you'll be able to access that handout there. So we still have about 3 minutes before we officially start. And I'll get into the housekeeping piece of it as soon as we reach 1 p.m. Eastern. But in the meantime, you've got a link to the handouts, and hopefully everybody can hear me. If anyone is on now, text the group if you can hear me. All right, thank you. I see that there's been some hand raising. Awesome. That means everybody can hear me. See. I'm getting some texts about handouts. I sent a link on the chat with the handouts. It says no link. Let's see. So unfortunately, I don't have the marketing department with me on this call in order to help me with the technical piece of it, but let's see if I can try to put those links. So we have about a minute to start. My chat's disabled. Let's see. Let's see if I can get that fixed before we start. All right. All right, so I've reached out to our team to see if we can enable the chat feature. It sounds like everyone is having some issues with the chat. Let me see. Okay, great. So marketing is going to be joining us in order to fix, hopefully, the chat option, and then post, of course, the handouts there for everyone. But you know, we've got a good amount of participants, and I want to thank you all for joining. We're going to start in just a minute because I see people are still rolling in. Just a couple of housekeeping points and items I wanted to talk about. Everyone's on mute. And so for any questions, hopefully we'll get that chat option fixed and you'll be able to type in any of the questions that you have. And at the end of the webinar, I will review some of the questions and answer those, of course, live here with you all. This session is being recorded and is going to be on our website. That website is SimiTreeHC.com. So you'll be able to go back in a couple of days or so. It takes us to upload that, and you'll be able to, see the recording again if you need to. If there's any questions that I don't get to or I haven't answered for any reason, please feel free to email me. I will show a screen at the end of the presentation with my email. So you're welcome to send me an email and I'll be more than happy to answer any of those specific questions that we didn't get to in the presentation. So my name, thank you again for joining. My name is Lynn Labarda, and I'm the VP of Post-Acute Revenue Cycle Management for SimiTree. Today's topic is an exciting one. Today's topic is new home health billing guidelines for telehealth. So we're going to review the new G codes for home health that CMS published in January of 2023. So this is a pretty exciting topic for me, specifically because I get asked so many questions on a daily basis about telehealth, especially around reimbursement. And we are going to talk about that as we move forward and through the presentation. So let's get into it. All right, so let's talk a little bit about our agenda for today. So our agenda is going to be, first, we're going to go over the background of telehealth, really in the home health setting, which is really different from other practices or other facility types like physicians or hospitals or so. And I think the fact that telehealth in home health is different, that's where a lot of the confusion comes in. So we're going to be able to clear some of that up as we move forward. We're going to talk about the new guidelines and what are specifically the timeframes regarding these timelines that we need to understand to stay in compliance. We're going to go over the new G codes. There's specifically 3 G codes that Medicare wants us to report. So we'll discuss those as we go forward. And we're also going to talk about some additional information, which is going to be the types of bills. There's also, certain types of bills that we need to use to be able to report in conjunction with the new G codes. So we'll get into the details of that. And really my goal for today's webinar is to be as concise, as make this as simple as possible, just to give you what you need in order to stay compliant, right? And in order to know exactly what you need to bill around telehealth. All right. So let's go on to the next slide. So telehealth in home health, a little bit of background on that. So telehealth, specifically the remote patient monitoring, has always existed in home health. Typically, I would see that the very large home health agencies were the ones that were really offering these services to their patients. And I would say why that is the case is because telehealth home health services weren't separately reimbursed by Medicare. And unfortunately, that is still the case today. So even with these new guidelines, and I'll talk a little bit more about that as we move forward, we are still not reimbursed separately for telehealth services, okay? So these are just new reporting guidelines, but the reimbursement piece of it doesn't change yet. Hopefully that will change, as we go forward. So, as COVID hit, right, the pandemic happened, and because of that, CMS temporarily allowed home health agencies to use telehealth visits in conjunction with in-person visits. And again, that was really just because of COVID. So COVID accelerated the use of telehealth in a home health setting. Before, like I said, we mostly see it happening for large agencies, mostly around the patient monitoring, remote monitoring systems. So specifically, the use of telehealth visits for the face-to-face visits is what we saw really because of COVID. Know that telehealth for the face-to-face visits were not allowed before COVID. So this is a new thing. So these waivers are still in place. These COVID waivers, know that they are still in place, and they're effective until I think May of this year. So far, we don't know if they're going to get extended or not. But for now, they are effective until May. And the most important part of this to know is that we're not separately paid for telehealth services. Not even with these new regulations will we be paid separately. These regulations are simply related to being compliant. They're regulations around the reporting of these visit types. And hopefully in the future, that's going to change. But for now, we are not paid separately for telehealth. All right, let's go on. So let's talk about the new guidelines. So effective January 1, 2023, home health agencies may voluntarily report the new Telehealth G Codes on home health claim periods of care that start on or after January 1, 2023. So prior to January 1, 2023, data on telehealth use was not collected on home health claims. Okay, so this is new. The only data that was collected on telehealth use was strictly limited to the overall cost data on the Medicare cost reports. That's the only place, and it was very simple, very specific, the only place where Medicare would gather information related to telehealth. So this is new now because we're going to have to be reporting the use of telehealth on claims. So on your claim data. So on July 1 of 2023, the reporting of these new codes that we're going to go over will become mandatory with HHA periods of care after July 1, 2023. So obviously mandatory means that we must report telehealth use. Otherwise, we are out of compliance with Medicare regulations. So as of right now, it's voluntary. So if you do any kind of telehealth visits or use patient remote monitoring, you don't have to report it. It's voluntary right now. But as of July 1, 2023, for all those periods on or after, you have to report. So that's very, very important. Very important we do that and follow the regulations. Obviously we don't want to be out of compliance. So in addition, Medicare stated that HHAs must document the medical record to show how the telehealth communications or teletechnology helps to achieve the goals outlined on the plan of care. And the plan of care must describe how such technology is tied to the patient's specific needs in the comprehensive assessment. So essentially, the use of telehealth technology does need to be mentioned in the plan of care and clearly state how this helps the patient reach their goals. So that piece of it is very important. It's not enough to just report it on the claim. You have to make sure that there is some documentation in your plan of care that discusses how the patient is reaching their goals from the use of telehealth. The amended plan of care also requires and states that these services cannot substitute for a home visit ordered as part of the plan of care. So just know that telehealth visits can't substitute an actual visit. That's part of the plan of care. And keep in mind that the COVID waivers are effective until about May of 2023. So your face-to-face visits can be done via telehealth. And of course, you would document all of this as described above in the bullet point. All right. All right. So, like we discussed before, a telehealth visit can't be considered a home visit for the purpose of patient eligibility or payment. So again, this is the most confusing part of telehealth today in home health. It's not reimbursed in the home health setting, okay? The collecting of the data on telecommunication technology use on HHA claims will allow CMS, though, to analyze the characteristics of the patients using services provided remotely. It will have a broader understanding of the social determinants that affect who benefits most from these services, including what barriers may potentially exist for certain subsets of patients. So what all of this means is that CMS currently does not recognize home health care providers as telehealth providers per se. It's really instead allows the primary care offices, the physician offices, to prescribe and bill for telehealth, where although they send us referrals where we would put patient remote monitoring the patient home, but we do not get paid separately for this. So it's really the clinicians and other healthcare facilities that prescribe and bill for telehealth services, but home health clinicians and home health agencies cannot bill for home health or for telehealth services and actually get paid. So that's the difference. It's a bit confusing because we'll get orders for patient monitoring, and or an agency decides that patient remote monitoring may help the patient meet their goals, but we are not paid separately for that at the moment. What we're hoping for is that these new regulations, as I stated, will help Medicare understand a little bit more the actual real-time use of home health, remote patient monitoring or telehealth services in our industry. And then in turn, hopefully sooner than later, we'll start getting separately reimbursed. At least that is the prediction. I'm pretty sure that is what's going to happen. We don't know how far that's going to be. It could be a year, could be two, could be more. I'm hoping it's going to be a little sooner, but this is the start. So this is actually a very good thing that Medicare wants us to report this data on our claims, because hopefully shortly after we will start getting reimbursed. And that's what everybody wants to hear, really. All right. So let's talk a little bit about the new G codes and how to use those. All right. So there are 3 G codes that, and these are all new as of January 1, 2023. So the first one is G0320, which describes home health services furnished using telemedicine rendered via a real-time two-way audio and video technology system. So really what they're saying here is use this G code when you're using video and audio. And of course it needs to be HIPAA compliant, but the use of video and audio at the same time is when you would use this particular G code. Then there's another G code, which gets, drills down and is a little more specific, that really talks about the use of audio only. So whenever you're doing a telehealth visit and it's rendered via phone, of course, real time, but audio only, then that is when you would use this G code of G0321. So G0320 is video and audio, G0321 is audio only. And then G0322 has to do with the collection of the physiological data digitally stored and transmitted by the patient to the home health agency. So that really has to do with patient remote monitoring, which is what we typically have seen historically in the home health setting more often, right? The remote patient monitoring. So those are the 3 G codes that Medicare wants us to describe on our claims, okay? And remember, it's mandatory as of July 1, and right now it's just voluntary. Okay. So there's some additional information as well that we need to keep in mind. And that has to do with the bill types. So Medicare has stated that only to report the 3 G codes on the type of bill 032X with revenue code 042X or 043X and so forth. Claims will be returned containing HCPCS codes G0320, G0321, and G0322 if there is not another line item on the claim with the same revenue HCPCS code other than G0320 and so forth. So really, an example here and what Medicare means is a claim with a line report. When you are reporting revenue code 0551 and G0320 must also have a code, a revenue code of 055X line containing the HCPC code of G0299 or G0162, whatever it is, because this is how you would do, for example, your face-to-face, right? So since you need to identify the discipline that's performing the telehealth visit. So, you're going to be reporting the G codes, the new G codes signifying telehealth, but then right after that, you have to have another line item which shows what discipline is actually providing that visit. Okay, so this is going to be very important for Medicare because they want to match up. All right, a telehealth visit is happening, and this is the discipline that is doing that telehealth visit. So report the use of the remote patient monitoring that spans a number of days as a single line item, showing the start of the monitoring and the number of days of monitoring in the unit field. So what Medicare means here is if you put a patient on remote patient monitoring in the patient's home, let's say you put the equipment in and you put it in for 10 days, then what you're going to do is you're going to report on one line the units as 10 days. So your units are going to reflect the days that equipment was in the patient's home. And Medicare only wants us to report one line when it comes to patient remote monitoring. So, be clear that a telehealth visit could be that audio or video or both type of visit, which in that case, you're going to report the right G code. And then right under that, you're going to report the discipline that did that visit. Okay, that's one type of visit. Or you're going to be doing patient remote monitoring, which in that case, you're only going to have one line reported. And that one line is going to tally in units the number of days that equipment was in the patient's home. Okay, so I hope that makes it a little clearer because, the first two G codes that we described in the earlier slides had mostly to do with the telehealth, the video, audio, and then that last G code had to do with the patient remote monitoring. And in this slide, we're describing that patient remote monitoring is only done in one line, with the units being the number of days. And then when it comes to the telehealth visit, you're going to report two lines. The actual telehealth appropriate code, and then under that, the discipline. So you're going to be submitting services provided via telecommunication technology in line item detail. And you're going to report each service as a separate dated line under the appropriate revenue code for each discipline providing the service. It's a little tricky, but obviously Medicare language is a little confusing to understand, but your billers should understand this, or your billing service. This is very typical of CMS rules that come down. They're a little bit unclear, but if you are an expert in the billing side of things for home health, you should understand how to properly report these and, of course, stay compliant, because that's the most important piece of this. All right. All right, so this is our last slide. We're just really going to summarize what we just talked about. This is not, as I said earlier, I want it to be as consistent, as concise as possible. This webinar is short, but it's to the point, and it's exactly what you need in order to stay compliant with Medicare. Just make sure that your billing staff knows about these new G codes and how to report them. Just again, remember that they're voluntary right now, so we've got time. We've got time in order to figure out exactly what Medicare wants us to be billing, and those mandatory requirements start on July 1st, 2023. I would reach out to your software company or your billing service. Make sure they reach out to your software company in order to make sure that your system is set up with the new G codes. So that way, whoever's doing your schedule is able to, quickly give them a bit of an in-service so they understand what the new reporting guidelines are, and they can just quickly, mark the right G codes that are being in use on that schedule. That's going to be really important, because remember that Your schedule is what captures the G codes, which then in turn go onto your claim. So your person who's doing the scheduling is going to be a key person in this, because they're going to need to get trained from your billing team, so that scheduling person can select the right codes, and that way it flows onto the claim, and of course subsequently it gets billed. So all right, thank you again for watching. Let me go through some of the questions. And again, like I said, if I don't get to any of your questions live, you have my email. So you can always reach out to me for any questions on telehealth. In fact, I'd be more than happy to answer any questions that you have related to home health or hospice billing. I mean, that's our expertise at SimiTree. So please, feel free to ask me any questions. I'd be more than happy to answer those. Let me go over some of these. So hopefully everybody got the handouts and you're able to see the chat. If for any reason you did not get the handouts or you do not see that in the chat, also feel free to email me and I can send you those. I can send you that handout by email without a problem. All right, let's see. So one of our questions has to do with what happens if you're attempting to use video and audio, but for some reason there's a connection issue and you can only hear the client, then which code should you report? So that's a great question. Unfortunately, the connection issues at the patient home is very common. It's pretty frustrating. If you cannot get the full video option and audio, then you're correct. You're only going to be able to report the audio portion of it. And that G code is the G0321 code. So that will be the only code that you get reimbursed for, or actually you don't get reimbursed, but you have to report. Let me correct that. Now, we don't know if like I said, we believe that we will be reimbursed in the future. We don't know if there's going to be differences in our reimbursement, if it's video and audio versus only audio. We don't know. We'll wait to see. But in the meantime, if you could only get audio, you can only report that G code. All right, let's see. All right, so we've got a question here related to if the patient is using their own blood pressure cuff, their own scale, and then submitting into an app and they monitor the use, does that count? So, from the information that we've gotten, and I can ask CMS and get a little bit more detail around this, is that it's the HHA that has to have put in the equipment. So if the HHA has put in the equipment and has that expense, then that's where you would report the use of the appropriate G code for patient remote monitoring. I'll do a little bit more research on that and see if I can get some clarification from CMS, but from what we've heard, it's the home health agencies that do have to have put that equipment in. All right, another question. To confirm, these G codes are to be used for home health and not Medicare Part B. So you're correct. These particular G codes are for home health, which is Part A. So this is not for Medicare Part B. These new G codes are strictly for home health agencies to report, to hopefully in the future be reimbursed. So we have a question of what charge amount do we use for these new G codes, and is the new charge pulled to non-covered? So we don't have any, this is new, we don't have any specific guidance from CMS on this. What we're just doing is putting a charge of $1. and we're billing these currently. So we'll see what feedback we get from CMS. Please feel free to reach out to me in the next couple of weeks, and I could research a little bit about if we've gotten any return claims or what other additional feedback there is from CMS. Usually, when there's a new guideline, CMS will publish that information, and then after a couple of months, when they see what we're billing, that's when they'll usually clarify certain questions that we have, or if they see a high RTP or rejection rate, then they'll come up with some clarifications. So just, stay tuned, shoot me an email, and I can give you an update on that. All right. So I've got some specifics on examples of what those G codes would look on a claim. I can shoot you emails on that. That's a little bit specific. All right, so, there's a question here on what happens if remote patient monitoring is introduced after the original plan of care. Well, you would just do a modified order or an amended plan of care, really a modified order, an additional order stating that you're going to be using remote patient monitoring. You don't go back and change the original plan of care. So any additional orders, whether it's patient remote monitoring or any other orders, you're just going to do like an amended plan of care or an additional order. So the question here is, will this apply to managed care organizations? Right now, this information is just from CMS. You know how usually CMS is who establishes the guideline, and then little by little, months after, some of the managed cares would adopt that information, or the Medicare Advantages would adopt it. Rather, we haven't heard anything from any managed cares at this point that they want us to report the patient monitoring or telehealth, but I'm sure there are some out there that some of the Medicare managed care that will very soon require that. And there could be some commercial insurances out there that are already paying for remote patient monitoring or telehealth services. There are some commercial insurances that we've seen payment on that. So it's going to be based on the individual insurance. Same question on the connection. If you can only hear, that's the only code you can report. All right. So I still am getting some questions about the fact that some of the handouts, they can't see the handouts, but again, shoot me an email on that. I can send you the handout if you can't see it.
And Lynn, this is the marketing department. We will be sending a follow-up email with a link to the recording as well as the handouts.
Fantastic. Thank you for that. I appreciate it. You saved the day. Let's see, what are the skills for common need? So I had a question here on, that they're a small agency and they don't use telehealth currently. Some of the small agencies, when you're talking about telehealth, it's specifically more patient remote monitoring, you're right. I don't see smaller agencies using telehealth when it comes to patient remote monitoring as much. And I think it has to do with the cost. So we tend to see larger agencies doing that because they've done a lot of cost benefit analysis, and they have found a way to absorb that expense for telehealth, remote patient monitoring, and almost use it sort of like from a marketing standpoint when they're going out and speaking to the physicians in the hospitals in the community, the facilities in the community. They're stating that they're using patient remote monitoring, and they feel that they're getting more referrals because they have that technology. So I think that's why some of the larger agencies are using it, and rather we don't see some of the smaller ones using it, again, because of the cost associated to it. And the question goes on, do we see more therapists using the telehealth, or nursing, mostly nursing using the telehealth? Not as many therapists. And then I have a question here about EMR systems, what we would recommend for startup agencies. Shoot me an email on that. I would be more than happy to give you an idea on what softwares are out there, what softwares are good, which ones are not. Know that as SimiTree, we specialize in home health, billing, coding, and hospice billing and coding. And we use so many different softwares out there. It doesn't matter what software you have, we are able to get a username and password and generate the claims for you on your behalf. But yes, there are some softwares out there that are a little better than others. So we'd be happy to give you some recommendations. So just shoot me an email on that privately, and we'll talk about that. Okay, so I have some questions here that are unrelated to the webinar, and I'm more than happy to answer those questions. I think it's from visiting nurses out of Illinois. Please do me a favor and shoot me an email with whatever question you have. My email is right there on that screen. I think you can see it. Shoot me an email and we can talk a little bit more detail about your specific question. So question here on how often do these codes need to be used in a 30-day period? And it really depends on the use of telehealth. So in a 30-day period, if you did 2 telehealth visits, you'll report it twice. So it's really upon need or upon when you are providing the service. So if it's a patient remote monitoring, then you're just going to report it one time with a span of days that you have the equipment in the patient's home. If it's an actual telehealth visit through video, audio, or both, then you're going to report it every time you do that visit. So think of it like a regular visit. Every time you do a visit, you have to report it on the claim, and this will be the same thing. All right. Okay, so I think that pretty much covers all of it. There's some questions here that are more specific, more details that I can get into through email, or if anything else comes up, please feel free to shoot me an email. And I really appreciate your time, and thank you so much for joining this webinar. I know that telehealth can be a little bit confusing in a home health setting, but again, whatever questions you have, I'm here for you. Happy to help. Thank you so much for joining. Have a great rest of your day.